Well, welcome everyone. My name is Valerie Arndt, and I'm the Executive Director of the National Association of Social Workers, North Carolina. And I welcome you all to day one of the North Carolina Social Work Advocacy Week. On this first day of March, we recognize that it is Social Work Month. This is a month that we not only celebrate our amazing profession, but it's also used to ensure that the public and our elected leaders know that social workers are and always have been essential. Not just 1 month out of the year, but every day social workers strengthen the well-being of those who are vulnerable and oppressed. Thank you so much to Governor Cooper, who has proclaimed March to be Social Work Month in North Carolina and recognizes the work that social workers have done to heal our nation during these turbulent and uncertain times. And I'm going to go ahead and turn it over to Kay Castillo, who is our Director of Advocacy, Policy, and Legislation at the National Association of Social Workers, North Carolina, to introduce the legislators we have with us today. I will let you take it away, Kay.
Thank you, Valerie. Thank you, everyone, for being with us today. This is a really exciting event. Normally during long legislative sessions, so every odd year, we're in person and we're able to be at the legislature and meet our legislators in person. And unfortunately, we just aren't able to do that. So we're so fortunate to have our legislators who have joined us for today. They're going to answer some questions. We're going to take some audience questions at the end. You can submit those through the Q&A down at the bottom of your Zoom screen. I'm going to go ahead and introduce all of them and then turn it over to them and let them do most of the talking for today. But today we have Representative Cynthia Ball. She represents District 49 in Wake County. She served 3 terms in the North Carolina House and currently practices as a professional mediator and volunteers with several Wake County nonprofit organizations. Representative Ball, do you mind addressing the audience and just telling them what committees you're on and any bills you're champion, and then I'll introduce the other legislators.
Okay, well, thank you, Kay. I'm delighted to be here on the first day of Social Worker Month, and it is a profession that is near and dear to my heart. Professional mediators in many ways are doing work that is very similar to what social workers do. And so I'm trained a bit in what you do, but certainly not a professional in what you do. As Kay said, I was elected first in 2016 and have been reelected twice to House District 49, though I feel that I represent every person in North Carolina and have to take into consideration, if I can, those needs and so forth that are across our state, especially in our rural areas. There's so many needs that are in our rural areas that those legislators like me who represent a metropolitan area do need to take into consideration. I'm serving again for the 3rd time on the Health Committee. I'm thrilled about that. And again on the Education K-12 Committee and the Education Appropriations Committee. And again, this time on a sort of revamped elections law committee. In addition to that, a land use planning committee. And through almost all of those committees, I'm working on some legislation, specifically right now working on a piece of legislation to expand the number of social workers and school psychologists in our schools. That is a dire need. We should have already done it, but I hope we can do it this time. In addition to that, I have several other bills I'm working on that benefit our public schools, because I think everybody agrees that our public schools are the very foundation of beginning people's abilities to be productive citizens, happy citizens. And so I've always considered public schools one of my top, if not my top priority, because it touches so many things. I'm also an advocate for transparency. I'll be filing again a bill to try to give you all, not just us, but you all, an opportunity to know more about how legislation is moving through our General Assembly. I have a hard time keeping up with the bills and understanding how quickly they can change through a committee substitute and how little notification I get. So I'm quite sure that people in the state of North Carolina have no idea and don't have a chance to reach out, as I hope you all will continue to do, about bills that you're interested in and that we need to know where you stand on them. So thanks for the chance to be here with you, and I look forward to talking some more.
Thank you, Representative Ball. Next, we have Representative Carla Cunningham. She is serving her 5th term representing District 106 in Mecklenburg County. And before being elected in 2012, Representative Cunningham was working as a hospice nurse and has a really diverse background in working in the field of nursing. Representative Cunningham, could you please address what committees you're on and bills that you're championing?
Thank you so much, and happy Social Worker Month to all you guys. I'm gonna tell you, I work on a lot of different committees outside of the General Assembly, but inside the General Assembly, I'm doing appropriations, Health and Human Services, believe it or not, wildlife, because I love to fish. A Health Committee, which I'm the vice chair on that, Rules and Operations of the House, Public Utilities and Energy, Commerce, and Local Government Land Use. That's 8. And outside of the General Assembly, I serve on the Serious Illness Task Force under the direction of the North Carolina Institute of Medicine. I serve on the Sickle Cell Council, that was appointed by the governor. And I also serve on the Office of Minority Health Council, which was an appointment by the speaker, and there's several other ones, but those are some of the main ones that I kind of try to stay on top of. One piece of legislation that I'm working on is, of course, I'm always working on Medicaid expansion, and that's expected to continue to work on that, but also looking at the suicide rates in our jails and our inmates is something also that I'm working on, because that's been going up and up in the last several years, and there's very little oversight in how we determine what they are doing in those independently operated facilities. Also, I'm working on mental health parity. That has become an issue in the state of North Carolina, and not just here, across the country, is that parity was put in place, but does it actually take place when the person ends up going to the facility for treatment? They may get a different outcome because parity is really not being honored the way that it should be. So that's been a huge issue. So I'm working on that, as well as, let's see, what else am I working on? I'm working on several pieces of legislation to look at the oral chemotherapy, which we were unable to get that passed. And due to COVID, it may be something that we can do temporarily, because a lot of individuals that were immunocompromised, still had to go to facilities and get their medicines through their port, instead of having the option of getting their medicines at home. And during COVID, that was something that I had brought to the attention, but we could never get it done. But we may be able to get it done temporarily under the governor's executive order until it ends. So those are a couple of things that I'm working on. And of course, Kay knows that I've always supported that we needed to put that additional school support staff in place. And it's been tough getting it done, but I think we need to keep doing it and keep pushing for it, because if we don't, after COVID, the expectation is that, one, we will see an increase in suicides within our children, which that's always been a long-term issue. We've never done well in that aspect. And also after COVID, the trauma of the social isolation is going to be a huge issue, and the children returning will continue to have some emotional, behavior issues. And I think those social workers and the nurses and the psychiatrists being available will definitely help with counselors as well. Thank you. I'll stop talking.
No, that's great. Thank you so much, Representative Cunningham. And last but certainly not least, we have Representative Ricky Hurtado, who is in his first term representing North Carolina House District 63 in Alamance County. He's the co-founder and co-executive director of an education initiative helping first-generation college students and immigrant families break down barriers to educational opportunities. Thank you so much for joining us today.
Thank you so much, Kay, and it's great to see everyone. Great to be part of Advocacy Week this week. Excited to kick this off with y'all. As part of my service in District 63, I represent parts of Alamance, but like Representative Ball said, I feel like I truly am representing the state of North Carolina and making sure that everyone's voices and needs are being heard in the General Assembly. I'm the son of immigrants and first-generation college students, so many of the issues that I'm actively working on are things that I've seen in my life or in my community's livelihoods when it comes to the educational and health outcomes of our community. So when we think about many of the issues already lifted up, but think about, especially now in the midst of COVID, when we think about how do we make sure that our children are healthy and safe, is sort of always on top of mind. And so what that looks like in terms of legislation, certainly some, more active than others in terms of what I'm working on, certainly supporting a number of bills, such as making sure we're fully funding our public schools and seeing counselors and nurses in every single one of our public schools. And so a lot of what I'm looking at is really thinking about that intersection, right? Where do we find our children, and how can we make sure they have the resources and support they need to be successful? And we know part of that equation always includes social workers. And so as part of my committee assignments, I'm working, like Representative Cunningham said, not just on what I'm serving on as a committee, but a lot of issues outside of it. A lot of my committee assignments take me in other areas beyond health and education, such as the environment. So the environment is something I'm thinking about a lot. Serving on the environmental committee, as well as the wildlife committee, along with Representative Cunningham. And so we actually overlap a lot now that we're talking here on the Zoom call. And so also on two appropriations committees that will be looking at the budget. So the General Appropriations Committee, but also the local government and land use as well as appropriations capital. So lots of work to do, and I think I'm 6 weeks in, so practically a veteran at this point. So, but it's good to be here today.
Thank you so much. So I wanted all of them to mention their committees, because the committee work of the General Assembly is really important to the process of bills making it through the General Assembly, what actually gets heard in a committee. There are a lot of bills that get filed, but not a lot of them make it through the process. So the committee work is really important. And the bills that you all introduce is really important. And you all mentioned a lot of bills and things that you're working on that support the NASW-NC legislative agenda. So we're all excited to learn today how we can help you advance those bills and legislation, and how social workers can be involved in the process of that. So I wanted to ask a few questions before we get over to the Q&A from our audience, but a lot of these questions are kind of geared toward our social workers who are, maybe this is their first time being involved with legislators and getting involved in the legislative process. We might have a few veterans, seasoned folks who have regularly talked to their legislators, but certainly with COVID, I think anything's game at this point, and how we do advocacy and how we talk to our legislators is just different now, doing a lot of this face-to-face. So with that in mind, you all have such a busy schedule. You're representing your district, you're representing really all of North Carolina. You have jobs, you have your own lives, and like you all mentioned, session moves so quickly. So what is a way that social workers can develop a personable relationship with their elected officials, and touch on how social workers can best communicate with their legislators? And however you all want to answer is fine with me. If you want to just jump in, that's fine.
Well, I'll start. As a matter of fact, I have 2 more appointments today like this with constituents who have reached out to me, and one is an advocate for our public schools. So therein lies, I think, the answer I would give you, that just reach out. When you send an email, describe a little bit about yourself, or if you make a phone call to my office, do the same thing, just so I understand a little bit more about where you're coming from and what are your specific issues. And I'm happy to talk to you. That's one of the things. There have been a lot of very awful challenges with COVID, but one of the things I think we've learned by Zoom, and of course now I think you're also streaming on Facebook, that we can reach more people and communicate more directly with more people by using a platform like Zoom. It only takes 20 so minutes on Zoom. You can just let me know. I'm happy to talk to you. I don't have to put on my fancy suit and go down to the legislature on a Monday to meet you, as has been my habit in the past, is seeing a lot of constituent groups and individuals on Mondays and Fridays when we're not in session. So this gives me a chance to kind of fill in on the days when I'm trying to do other things and meet with you. I think the more we get used to Zoom, the less it feels like we're not really connecting. At least it does for me. So invite your questions and your requests to talk to me on Zoom, or if you prefer to talk on the phone, we can do that. And I am taking meetings, not in my office, it's very small, and I can't give you the protection of social distancing in my office, but I am meeting out in our court areas with you if you feel like you want to come to the General Assembly and meet. We have some socially distant tables that we can meet with you, mask, and of course, I always wear one. I wear two. And I encourage all of you to do the same thing with these new variants. But it is a fantastic opportunity to hear what you are thinking, so we know more about how to address the needs of the people that you all are representing, and those of you who are practicing as social workers. Let us know what we can do to help.
Thank you. Thank you. I think I'll go next. I have an open door policy that my office has. So, you know, you can always pick up the phone and call the office. And also I answer my phone at my house. A lot of times it's calls that I don't want from telemarketers, but sometimes it's good to hear that voice on the other end and to get a full picture of what you all may have in mind. Of course, we read emails. Sometimes we may get 500 to 600 of them a day, and we screen them. But usually, you know, if it's in reference to a need or something you need to have a conversation about, I welcome people to pick up the phone and call. Sometimes the email may not always reach me. And also I've partnered also with lots of individuals within my community. UNCC actually has a social worker program. I've been out there several times and attended some of their events, and some of them are quite huge. But those relationships are long-term. I've spent years building those relationships with my community here in Charlotte and across the state, as participating in several mental health events that lots of social workers work in. So I have a long history with dealing with social workers, and it's important. And also I bring my personal life experience. So my son, which most everybody knows, is I say special needs, but he's dual diagnosed. So we've been heavily engaged in the process with a social worker for numerous years. And I definitely appreciate the work that you all do, because it definitely makes my life easier. So, you know, it's an open door policy, any need, or sometimes I've gotten emails about answering. Some people may be doing something in school and they want me to have input. And normally I will go ahead and answer those, or send a number where they can reach me and we can have a conversation by phone. So it is much easier to do the phone call for me instead of doing an email, but do an email for, you know, informational purposes. I may have to investigate a little bit further and I can provide that back to you. So that's pretty much, Zoom is fine, but also we doing Microsoft Teams, we doing WebEx, and some days you may be on 7 to 8 hours. Zoom is very tiring, but it's okay for the moment we in, but I'm hoping that it doesn't last much longer, that we will have that personal in-person contact available to us once again. Thank you.
Yeah, I'll just quickly add here, beyond the advice you've already received, is for me as a first-time legislator and someone who is deeply invested in listening to the community, I'm still looking for trusted and reliable sources of information, right? And so if you can establish yourself as that someone or people in the community, right? Building a relationship with your legislator at the end of the day is like building a relationship with anyone else. And so, you know, we want to be able to know that, you know, the information we're receiving is accurate, that we can have a relationship, a two-way relationship, and that we can discuss, you know, difficult topics happening in our community, right? You won't always agree, you know, so every time you disagree, but being able to have that dialogue, I think, is really important. I'd say the other part to this is our legislative aides are an extension of our office, of us. And so building a good relationship with them also really matters. Many times, many of the conversations are happening in any given week isn't just solely with me, it's with the legislative aide. And that person has the most conversations with me, at least, of any given person in a given week, and is keeping me up to date on issues, on conversations that they're having. And so that is, I think, is also a really important part of this process, where even on the busiest of weeks, you may not be having a direct conversation with the member, but don't think that your message isn't getting across, because all the emails or the phone calls between the two of us, your message is getting there. And depending on the urgency of it, we'll certainly be following up as soon as possible.
Thank you so much. I hope everyone heard the message that legislators are accessible, and that communication is key, and that social workers have a valuable voice in the work that you all do. So I'm wondering if you all could talk about how social workers can best get involved in the legislative process. You all mentioned bills that you're championing and committees that you're on. So how can social workers make that connection between, Representative Cunningham, you mentioned you're working on Medicaid expansion. So how does our audience get involved in things like that?
Well, the Medicaid expansion, we've been attempting since 2013, when some legislation was put in place that repealed and does not allow us to expand Medicaid under the legislature statute. But of course, we're in a different state right now of some incentives that may be coming down from the federal to encourage the 12 states that have not expanded to expand. And North Carolina happens to be one of them. So I would say it's completely state engaged. I'm sure that it's going to be nationally talked about. We're still trying to find the right space and the right time, negotiating with our counterparts to see when we can come together on it. And once we find that space, we're going to need all the help that we can get to call those offices and call those legislators and those senators over in the Senate that may not be on board, and tell them we need to do this for North Carolina citizens. At one time, they were saying it was 500,000. Then another time it was 600,000. Right now, it's 1.2 million people in the state of North Carolina that currently do not have any type of healthcare coverage, because you had over 250,000 individuals that lost their jobs. And when they lost their job, they lost their insurance, because the insurance came with the job. So now we're at 1.2 million, and the incentive would relieve the state of any cost for the first 2 years at that 90-10. That's what's going to come down from the Biden's rescue plan. It's called the American Rescue Plan. And when we get that space, we're going to need the biggest push on the senators and on the representatives that are not ready, because everybody else is ready, and we definitely are ready. Representative Ball, Representative Hurtado, you just got there, but we've been ready, but we're going to need that support with us, pushing hard, ringing those phones, no matter what it takes, over and over, and sending those emails over and over, and picking up that phone when we get ready to push.
Well, I can certainly underline all that Representative Cunningham mentioned. Medicaid expansion has been a top priority for us. We held firm on it in the last session, and as you all know, it was a sticking point that kept us from being able to pass a budget. And I believe, I'm a mediator, as was mentioned earlier, and one of the reasons I ran for office was I thought that I could bring some skills, and actually people seem to like that idea of having us work together. What I believe is that the people of North Carolina support Medicaid expansion. Somehow the representatives representing those people, some of them do not. So we're going to continue, as Carla Cunningham mentioned, we're waiting for the right time and to build some support for it before we come out with our particular bill to expand it. It may not look exactly like the full Medicaid expansion, which we just know we need to close that coverage gap and provide those hundreds and hundreds and hundreds of thousands of people who have no Medicaid, have no health care services, especially in some parts of our state where our hospitals are closed. I saw one of the questions in the Q&A that the question was, how do we get some services in my area for social work? Because we don't have an opportunity for that. We have a serious problem all across our state to fill the needs of people who don't have coverage, and we need to find a way to do that. As far as other things that you can do, I think that was the question, as far as how you can reach out to us, and how I like to think of it is, how can you help me? I want to help you, but how can you help me be a better representative and be better educated? It is overwhelming how many bills are filed. And they have lots of little nuances in them. And as you know, if you follow the bill, you lose control of it as soon as you file it. And so it's going to change from the time it's filed to the time after it has first reading to the time it goes to a committee. There's always already going to be a committee substitute. So I would suggest, if you have a group of people that you are working with and this organization, maybe you can split up into teams and follow certain pieces of legislation and help us. Let us know, what are those unintended consequences that are in those bills that we can, sometimes we can't fight against a bill and completely keep it from passing, but we can make it better. And with your help, we can find those ways to amend it and be able to stand up and speak in committee and on the floor, because you all have reached out to us and told us, you all don't understand, if you do that, it's going to cause this. And that is a very effective argument on the floor. And if we have those arguments, we can actually go to some of our, not just colleagues in my party, but the colleagues in the other party, and say, look, you don't realize what this is going to do. And let them run the amendment if that will help it pass. But just let us know, what are those things that are in these bills that have a negative impact on what we know we need to do.
Mm-hmm. Yeah, and again, I'm letting the veterans here give you the sound advice. The only thing I'll follow up with is that everything Representative Ball is exactly right in terms of drinking from a fire hose, right? It never really stops in terms of the number of bills that are filed and everything that we have to become experts in. It feels like overnight, but we can only do that with your support, right? And I think that for part of it is not just knowing why you support or oppose a bill. I love getting those emails, right? Like a personal, like, this is why this is bad for my community or my profession or whatever it may be, but also a story that connects the data point to humanize the issue, right? Oftentimes, the only way we can effectively communicate this in a committee or on the floor, right, or even to the media is to be able to say, this is how this bill is bad for children or bad for teachers or bad for social workers. And being able to effectively communicate that with your experience in the field is actually really valuable. And so send us those stories, send us those reasons to why you're for or against the bill. And it actually helps us do our job better.
That's really great advice. So one of the questions in the chat was how to kind of first get started. Who do you contact? So I'm sorry, I didn't realize I was muted again. The really great advice. And so one of the questions was, how do you get involved? Who do you contact? So I'm going to put in the chat how to find your legislator, which is on the General Assembly website. And it's a really useful website. You just type in your address and it'll actually give you your NC House, your NC Senate, and the Congress and NC Senate as well. But if you're looking at something like Medicaid expansion in the state, or school social work, or how to get resources in my county, you're looking for your NC House and your NC Senator, and that's kind of the focus of what we want to talk about today. And all three, I didn't mention this before, but just to clarify, especially if you've never been involved in the process before, all three of the legislators today represent us at the North Carolina General Assembly. So in Raleigh, not in DC. So they're going to be working on those things that impact us in the state directly. So I also want to ask you all, what is, and so Representative Hurtado, this first one is for you, but what's it like being a legislator? So you're new, this is your first time. What's that like? This might kind of help relate your experience to social workers and maybe help social workers connect the dots for, you all as people, you all as representatives and elected officials. But what's been your experience so far?
That is quite the loaded question there, so I'll tread carefully here. No, I'm mostly kidding. I think it's been the most fascinating sort of social experiment for me that I've been a part of. What I mean by that is that it's, folks from all walks of life coming together to sort of make decisions on behalf of the people of North Carolina. And so for me, it's been an exercise of really understanding human behavior, right? What motivates people? What are they interested in? how can you sort of communicate effectively with them? How do you build relationships? And so it's been like that for both on the Democratic side and the Republican side, right? I've taken, meetings to sort of meet the chairs of our committees and across the aisle, but also our own colleagues, right? Who can mentor me, who can sort of tell me, the ins and outs of XYZ bill. And so it's interesting. It's not exactly a position that comes with a instruction manual, right? So you sort of have to figure it out as you go. But I will say that there's incredible people who have been there already, who have years of experience that will certainly be willing to help you along the way. And so I'm taking sort of some of my own advice that I share with my students all the time, right? That the best advocate that you can have is yourself. And, you really have to ask for help. And it truly takes a village. And it is certainly the ultimate team exercise in supporting and defending against bad bills. That is certainly what I'm a part of right now. So it's been an exciting last few weeks.
Thank you. And Representatives Ball and Cunningham, as seasoned legislators, what are the things that you've learned over the years? Sometimes you might get social media news or news written up about you, and it's like, if they only knew the process or that sort of thing. So what are some things as a seasoned legislator that you can share with us? And then after you all answer, I'll introduce Representative Susan Fisher.
Well, when I first got there, I had one of my colleagues to tell me to be seen and not heard. And that was their advice. But that didn't work for me because Cynthia laughing, that didn't work for me because I knew I was elected to represent, the 70 or 80,000 people in my district, and they didn't send me there to be quiet. They sent me there to advocate for the needs in their, my constituents in their district. And so I just couldn't do it. But anyway, it takes a lot of time to learn the process. It's fluid. It changes frequently. But most of your time is spent building relationships with your colleagues and across the aisle. And you have to invest in that, because if you don't, you need everybody to help support your legislation to move it along. In most cases, it may go to rules to die, but building those relationships, not just on your side of the aisle, but on the other side as well, are very important. And also doing a lot of reading. When lobbyists or special interest groups come to you, you can't just say, well, what they're telling me is 100% true. You have to still investigate for yourself. And when you have questions, you need to ask someone, because you'll find yourself sometimes signed on to things that are not really in your best interest or your constituents' interest to sign on. So you have to still do a lot of reading, and you have to do investigating as well. Thank you.
Well, Kay, you asked what I have learned. I think probably at the very top of my list is something I mentioned earlier. The lack of transparency of what we do. From the time a bill is filed and it goes to a committee, sometimes it's on that. We had a bill that was filed last week that was immediately in a committee. Sometimes it does not. It does go, as Representative Cunningham said, to rules to die, unfortunately. But sometimes a committee, if it's got the urgency and the right sponsors, is going to almost immediately be heard. So you have to be attuned to the fact that bills are going to move differently than you expect. Not House Bill 4 moves before House Bill 112. That's not necessarily the case. It depends on the urgency and, frankly, who the bill sponsors are. But I'm an advocate for giving you all and ourselves the opportunity to know what's going to come before us sooner than 9 o'clock the night before. That's what our rules say. That we're and what am I going to do? Call all of you all? Do you want my call at 11 o'clock at night saying, "Okay, tell me about," fine, we can agree to that, but that's just not right. We should give the public and legislators, but the public, you all elected us. We work for you. Give you an opportunity to know what the bills are about, so that you can reach out and talk to each other and form a coalition of 5 people that just absolutely inundate every member of the General Assembly with your concerns. about this particular bill, even sending what the language of the amendment needs to be. And if you only have from 9 o'clock at night till a 9 o'clock the next morning committee meeting to do that, or when it goes almost immediately to the floor, maybe the next day, that's not even 48 hours for you to be able to advocate for something that you know needs to be changed. So we need to work on that. So I've learned that. That's why I'm advocating for more transparency, and we'll file that bill again. And I'm going to convince my colleagues all across the aisle to understand that this is what the people of North Carolina deserve.
That's great, and thank you so much. So I want to take a moment and introduce Representative Susan Fisher. She is in her 9th term, I think 9.5 terms, representing District 114 in Buncombe County. And she has, before serving in the House, she had experience on the Asheville School Board for 8 years and worked as executive director of the nonprofit organization Kids Voting. So she has a lot of great experience. Representative Fisher, if you don't mind just letting the audience know what committees you're on, any bills that you might be championing, and we've kind of just been talking, having an open dialogue about how social workers can reach out to their legislators and be involved in the legislative process.
Okay, it's really nice to be with y'all and my fellow legislators, both young and old, new and not so new. You know, I am so happy to be with a Zoom room full of social workers because I am the mother-in-law to an MSW, and I do anything I can to make my children proud of me. So it's always good to be able to, I'm getting extra brownie points just being here. So it's awesome. Thank you for inviting me. I'm serving this session on the Education Committee, Education K-12, which deals with the policies. I am also on Education Appropriations, which deals with the money that has to do with every aspect of education, from preschool all the way through to college and beyond. I'm also on the ABC committee, the Alcoholic Beverage Control Committee, and maybe that has something to do with the fact that I come from this place that helped pop the cap when we started having these craft breweries emerge all around the state. Asheville is where I'm from, and we got plenty of those. And it's really going to be nice once the COVID pandemic has subsided to see all of those folks back in business again. I am serving on a local government, local planning and development committee. I'm also a whip for the Minority House Caucus, which means that I try with my colleagues to whip the vote, as it were, to make sure that we have, at least have in mind what the numbers of folks are who are going to vote yay or nay on a bill. That's an elected position from within the caucus, and it's a real honor to be able to serve in that way. I just left a press conference to come be with you all, and the press conference was really something that I think a lot of social work folks might be interested in. And it's a bill that removes the barriers for reproductive health care for women. And we've lovingly named it the RBG Act. RBG, of course, stands for Ruth Bader Ginsburg, but it also in this bill has to do with removing barriers. So we've had a really positive start to the running of this bill, and I'll let you all know just for fun, those bills have just gotten numbers. The Senate bill is Senate Bill 167. The House bill is House Bill 188, and that's their companion bills. So they look just the same on the Senate and the House side. I am so happy to be able to be with you all and look forward to the rest of your questions.
Thank you so much. I was just sticking, I stuck the Senate version of the bill in the chat for everyone to take a look at. And I appreciate that. And thank you for that. I've seen a few things kind of going back and forth in the chat about reproductive rights and how to make those accessible. So I'm going to turn it over. I'd like to move over to some of the audience questions. We've got about 20 minutes left, and some of the questions are kind of repetitive, which means a lot of social workers here want to know the answers to this. But a few questions we've gotten is, and this is kind of in line with communication and what we've been talking about, but you all have express ways about reaching out to legislators and kind of, just taking the step and emailing or calling their office. But what about a legislator that, a social worker might look at their profile and say, I don't know if they'd support Medicaid expansion, Representative Cunningham, or I don't know that this is something that this would be, that they would be as open to as you all are open to. So what's a good way to kind of break the ice to open the door to a legislator that may not agree with everything that a social worker might agree with? And not saying that all social workers are believe in created equally, but just, a legislator that, they filed a lot of bills that I just don't agree with.
One of the things that I think is very important to a legislator sometimes is that personal story, or someone in your family that has had that experience. I know before I was elected, I partnered with Lifespan, and they do IDD clients, and I brought them up to see Tillis actually, but Tillis was unavailable. So actually they got to see Senator Berger, and I was in the room with the family members as they spoke to him. And I was really taken back by how much attention he paid. And if you all will notice, in the last couple of years, he's actually asked for more innovation waiver slides. And those innovation waiver slides are for the IDD mental health population, which right now we have about 15,000 waiting on that list. And we only fund so many because you have to fund them for the rest of their lives. But we've been behind on funding them. So sometimes it's just that personal story, or someone, a family member or a loved one or someone speak in volume to that legislator, because he may not understand, but when you bring that personal story and can engage him on that level, he may think back and say, oh, I know someone like that, or I have somebody in my family that's having that same issue. I found that to be effective. No matter, even if they come with a different philosophy, they usually will stand on that. But once you engage them on that personal level, sometimes it changes what they think about it.
Well, I'll just add to that. I know there's a lot of passion that we all feel about things that we really support, and also that reverse passion about things that we just feel like we cannot tolerate. We all receive a lot of emails, and I can tell you, I get some that get pretty nasty because people don't agree with me. But I imagine my colleagues, I'm a Democrat, and my Republican colleagues probably get equally nasty emails from people who maybe agree with me, but not with him or her. But the emails that I pay the most attention to are those that give that personal story, that show me that they really want to engage me and find out what are my thoughts about it, what are my feelings about this, and very reasonably, I'll use that word, outline why they disagree with me, as opposed to just nailing me to the wall because they don't agree with me. So the same thing would be true for those people who are Republicans and who don't. Somebody in the question and answer asks why we can't pass Medicaid expansion. 100% of the Democrats supported it last time. There were a few Republicans in the House who were willing to advance a piece of legislation that I lovingly called it Medicaid Expansion Light. But we were going to get something, but Senator Berger refused to even let that be heard. But I'm sure that those Republicans get pretty nasty emails about that. So you have to make the case to those people with whom you disagree without being disagreeable, if that is helpful to you.
All right, thank you. That is very helpful. Representative Fisher, did you want to add anything?
Sure, I'll just say, often when I see lobbyists come through the office on different topics, you know, I can tell what they're coming to see me for generally. And I have to decide in that moment, okay, am I going to go with my first impression or the thing that I know about this person, or am I going to open my mind and my heart to hear what they have to say? And so I guess I would just say to any of you all who are trying to make your voices heard, as I know that you do, you come to the Capitol and you come visit with the legislators. Just be willing, set that example of what you would like. You want them to listen to you, so listen to them. Give them some chances to be the kind of people you would like them to be. And then I think that will open the door to conversation. We need more of that for sure. And on both sides of the aisle. So thank you for taking the chance to do that.
Anything else you'd like to add, Representative Hurtado?
I think it's been covered, but yeah, I'll just reiterate the point that, you know, I would assume any conversation you go into, one is uninformed and not necessarily because of lack of a sense of apathy or they don't care. And I think entering a conversation as an educational opportunity has always benefited me, even with folks that disagree with me. I've been pleasantly surprised the number of conversations I've had already on challenging issues where we both leave the room not agreeing, right? But at least with an understanding of where we're coming from.
That's great. Thank you so much. So Valerie, were there any questions that caught your eye that you wanted to address before we get into our last 10 minutes?
Sure, there were lots of great questions, and I think you all touched on it a little bit. I just want to reiterate that NASW North Carolina is a nonpartisan organization, and we work very hard on both sides of the aisle. And if we didn't, we would not get anything done and not get any of our issues moved forward. So some of the questions included, how can we have conversations or sway some of our legislators that don't have the same thoughts and on the issues that are important to us? How can we really sway some of those legislators or really move the dial on certain issues? And then I did see that a couple of folks were having trouble getting a hold of their legislators. They've called, they've sent some emails. What is the best way that a constituent can reach out to their legislators after multiple tries?
Well, good questions. And I think that the COVID pandemic hasn't helped very much with a lot of that. And I'm not going to use that as an excuse necessarily, but I do think that it has sort of put a little bit of a barrier between what we can do in terms of visiting with folks one-on-one. But, you know, in my experience, if there's somebody that I want to talk with, I usually go to their legislative assistant. That's the rule of thumb in the legislature anyway, is that if you want an answer to a question or you want an appointment with your representative, go to their legislative assistant or their LA. That's a pretty direct route to getting to at least have 5 minutes with the legislator, and it's definitely worth it. So yeah, and then about touching on things that you figure the person you're lobbying doesn't agree with you about. Well, you can't know until you try. And so I know there are tons of lobbyists around the General Assembly who try again. And some are successful, some are not. But you know, you can't get anywhere until you just give it a try. And again, I go back to the thing of being that example of listening, so that the person that you're talking with or trying to get a point across to will listen to you.
I guess I'll respond to it. We have one legislative assistant in our office. It's not like we got a whole lot of staff members. So you have to email. And usually during office hours, if you call during the day hours, then you will get the legislative assistant in the office. Like I said before, we can get 500 emails a day. And she usually combs through them and she'll mark them if they're very important, and then we'll try to handle those first. But I've told people, you can pick up the phone and call me at home, especially if it's an emergency or a situation that needs to be dealt with quickly, because I get lots of the Department of Health and Human Services calls for the mental health and IDD and substance use that may be going on right here in my district, that I need to reach out to someone locally. You know, I may be in Raleigh, but I still have the capability to reach out to someone locally and handle that issue. I saw a question in the chat and I wanted to respond to it, and it was about the jail suicides as well as inside of the correctional facilities. And they were asking, is that the only focus? No, it is not. Since I was elected in the legislation, the first piece of legislation that I put forth was on suicide prevention. And fortunately, within the last cycle, we did have some funding put in for mental health crisis. It was about $4 million that went into there. And it went through the DPI, which is Department of Public Instructions, as well as some training, mental health first aid that has to be taught in the schools right now. Because as I had said earlier, we haven't done very well in that space of preventing suicides of our youth in the state of North Carolina. We have always been above the national average. So the work continues in that space. Thank you.
Kay, I wanted to just say one little thing, Valerie. One thing just occurred to me as I was listening to that response. You know, I respond to Kay when she calls because I know her and I have a relationship with her, and it has happened over time. And I'm not saying that we welcome people to come knocking on our door every 5 minutes so that we get to know them. That's not the kind of get to know them that we will do best with. But over a period of time, when you know that a person that you're working with has consistently brought you constructive and good ideas, you're going to open your door to them. And so I encourage you all to keep coming. You know, if Kay had come to my office one time, that might have been that, but Kay keeps coming back and keeps coming back, and in a good way. And so I just stress that you keep coming back in a good way, and you'll see those doors open.
Thank you for that, Representative Fisher. That's great advice to keep coming back and keep coming back in a productive manner. We certainly try to work with everybody. We think social workers are in every district across North Carolina, so it doesn't matter, what county or who's representing, but NASW does a really hard job of making sure that we make the social work connection to everybody. So we're in the last 5 minutes. Is there any, last minute word you'd like to share before we end today?
I just wanted to address a question. I think I saw a couple that alluded to this in the chat or the Q&A about why we are not able, what are the things that are standing in the way of getting more social workers in our schools? And I'd say it's a matter of budget priorities. I'm hearing a whole lot of very bipartisan support for the fact that we've always needed more, but we certainly now, through the pandemic, it's a crisis now. Our kids need more help in schools as they come back because they have had these awfully adverse experiences. I can't even imagine what it's been like for many of them. And so I think I'm seeing a momentum of bipartisan support for it. So we just have to make the case for that being a very top priority for us. We have the funds to do this. We have an even better revenue picture than we were anticipating. We have hundreds of billions of dollars in our rainy day fund. And to my mind, it's not just raining, people are drowning. And so we have got to do something to help our kids get back to school. We've got to do something to close the coverage gap. We've got to do something to improve our the adverse early childhood experiences through having the opportunity for people to have, somebody mentioned about whether or not we're going to have parental leave. Yes, we need that. Yes, maternity leave, we need that. We need a lot of things that will benefit our families. We have needed it for a long time, and we really need it now.
I'm going to chime in and say, you all need to get a social worker to run and get her elected or he elected. I'll have to say that I was the first nurse to come, and since I've been elected, we've had 3 more nurses to get elected. And they're on opposite sides of the aisle. So you definitely need to pick you one and support her.
We've got Senator Sidney Batch, and we've got Representative Greg Meyer. And then we worked hard to try to get Dr. Kimberly Hardy elected. So we'll keep supporting her.
Yeah, we've got two. I forgot about Greg, but Sidney went to the Senate. Yes. So yeah, so you need to just keep focusing and targeting, because what I realized after I first got there is that it's not a lot of clinicians. It has significantly changed over the years where you have more clinicians getting elected. Most of them are small business people, or either they're retired educators or they retired from something else, but most of them are not clinicians. And I think the change the inside of the legislature in order to get the type of legislation that will come out is going to take diversifying that voice inside of there. So yeah, I forgot about Greg, but you're right. You got 2, but Sidney not with us no more. But yeah.
Send us another one to the House is what Representative Cunningham's saying.
Absolutely.
Send us another one in the House. At least one more.
We'll try our best.
How about 2 or 3 more?
Yeah, that'll help.
Right. As Representative Meyer says, both sides, the House and the Senate, need social workers. So we'll work on that. Yeah. Well, I'm going to wrap things up, and I want to thank Kay Castillo for doing a great job of moderating this panel here. I want to thank each and every one of you all, Representative Hurtado, Representative Ball, Cunningham, and Fisher, for joining us today. I just want to mention to the audience, as the legislators mentioned over and over again, they rely on you to educate them on what social workers do as a profession, what issues are critical to you and the populations that you serve. It is in your NASW Code of Ethics Standard 6.04. Social workers should engage in social and political action that seeks to ensure that all people have equal access to resources. So you all need to continue to reach out to your legislators and let them know what social workers do, especially many of these new legislators don't know about the social work profession. So they really rely on you to help educate them. So, but Kay Castillo is our lead lobbyist at NASW North Carolina, and as Representative Fisher said, she really relies on lobbyists to help educate representatives on what's going on. So NASW North Carolina is working hard to advocate on behalf of social workers of North Carolina, and welcome you to join us as a member of NASW North Carolina. We are the only association that has a full-time lobbyist to advocate on behalf of the social work profession. And we need your voice now more than ever. And I really thank you all for choosing the social work profession, and happy Social Work Month. Thank you all so much.
It's been a real pleasure, and I hope I will hear from, let's see, we've got still 300 people on the call. I'll take those 300 emails. I will stay up tonight and read them. I promise you.
You got it.
I'm in too, Representative. Send them on.
Send them.
Thank you all so much.
Thank you all so much. You have a great rest of your afternoon.
Thank you.
Take care.